Minister, respond to this. At the end of this meeting, talk to Phil Hay, talk to Peter Hughes, talk to those people that can actually make the difference. And Minister, if you don't, it'll be on your head, patient safety.
Deputy McWallace.
First, I'd like to welcome all the nurses in the gallery today. And I want to counteract really the nonsense that the government are putting out, that the staffing levels are okay and that there's no issue with recruitment and retention. The INMO have shown there are 103 fewer staff nurses employed today than were in December 2007, and that there are 1,650 fewer nurses and midwives today than there were in 2007. The INMO has informed us that hospitals are unable to recruit midwifery staff to match the recommended staff level of staff midwives to birth ratio. The PNA have said that there has been a 40% vacancy rate in psychiatric nursing, their figures they got, and at the same time the IMO have figures that the HSE are paying out 1.4 million a week in agency nursing, and in psychiatric nursing in 2013 it was 14.3 million spent on agency nursing, and it increased to 53 million in 2017. That is the scandal that we're facing as a public in relation to how our health service has been run. The use of agency staff is the irony is unbelievable. The HSE are paying agency nurses 20% more than the nurses they work beside in the public sector in our hospitals. So much for equal pay for work of equal value in relation to this. In response to that PQ, and those figures came from a PQ that was put in last year, the HSE said this expenditure should be considered in the overall context, including increasing demand for services, absolutely, and the impact of earlier constraints on recruitment in the public service, absolutely, and ongoing challenges in relation to recruitment and retention of clinical staff. That was the HSE in a statement in response to that PQ said. And the HSE are admitting there's a problem with recruitment and retention, but why are you not admitting that it is a huge problem and has to be dealt with? Nurses are leaving their jobs and the country to go to Australia, Canada, private hospitals and agency. That is the reality. The government say you have to be responsible, the nurses have to be responsible, that we can't afford to pay 300 million out of a 17 billion health budget, or at the back of all the other issues of where money can be wasted. Just think about this. You can afford to pay the 450 million or 700 million with contractors breaking tenders in the Children's Hospital. You can afford to pay, it was reported in the news the other day, to let the Department of Justice pay €1,000 per week on taxis. And that the Department of Foreign Affairs can afford to pay €1,000 per day on taxis. That's a responsible government, yeah, that's really responsible. And what is really offensive is that at the same time, those TDs over that side of the House who are telling nurses and midwives to be responsible, they've just pocketed over €7,800 over the last 2 years in the reversal of the FEMPI pay from January 2017. I didn't take it because of the reasons of what's happening here today and for teachers' inequality in pay and others. I gifted it back. But these are the same people who are tackling nurses and saying, get off the picket line, don't turn your back on your patients in the hospital. We know, I listened today, and I finish up on these 2 points, I listened today this morning on the radio, reports that the patients are at risk. Patients are at risk every single day of the year, Minister, and that's why these nurses are out in the picket line, because they will not stand over continuing that risk and patient safety. There is a way you can resolve this. There is the public service pay agreement, where there is a section in that pay agreement that says there can be a review of the recruitment and retention. Why not immediately call talks and look at probably paying a substantial down payment to start the talks and then go into negotiations on reviewing it. Nurses all over the world are in solidarity with this action. They're saying, give us a reason to come home. Minister, give them a reason to come home. And come out on Saturday at 12:30 to support your nurses and your midwives and psychiatric nurses and GPs who are saying that the system is in crisis, it's crippling and has to be dealt with. Minister, respond to this at the end of this meeting, talk to Philny Hay, talk to Peter Hughes, talk to those people that can actually make the difference. And Minister, if you don't, it'll be on your head, patient safety.